In this video by DeckPlate we will be discussing ear conditions, some of the most common ear conditions experienced by military personnel. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. 5 most common ear conditions veterans encounter during military service. While serving on active duty, service members are often exposed to loud, harmful noises. As a result, many veterans suffer from a number of different ear conditions later on in life. Such veterans may be eligible for VA disability benefits if they can prove to VA that their ear conditions are caused by their time in service. Meniere's syndrome, Meniere's disease, is an inner ear problem that can cause dizzy spells, also called vertigo, and hearing loss. Most of the time, Meniere's disease affects only one ear. Meniere's disease can happen at any age, but it usually starts between the ages of 40 to 60. It's thought to be a lifelong condition. Causes of Meniere's syndrome. The cause of Meniere's disease isn't known. Symptoms of Meniere's disease may be due to extra fluid in the inner ear called endolymph, but it isn't clear what causes this fluid to build up in the inner ear. Issues that affect the fluid, which might lead to Meniere's disease, include poor fluid drainage. This may be due to a blockage or irregular ear shape. Autoimmune disorders. Viral infection. Genetics. Because no single cause has been found, Meniere's disease likely has a combination of causes. Long-term effects of Meniere's syndrome. The most difficult complications of Meniere's disease can be unexpected vertigo attacks, possibly losing your hearing long-term. The disease can happen at any time. This can cause worry and stress. Vertigo can cause you to lose balance. This can increase your risk of falls and accidents. Diagnosis of Meniere's syndrome. Healthcare providers will examine your ears and ask about hearing loss, tinnitus, or a sense of fullness in one or both of your ears. They may ask if you have regular bouts of vertigo and hearing loss. If you do have those problems, they'll ask if those bouts are severe and how long they last. They may do tests to rule out other potential conditions and confirm you have Meniere's disease. Hearing test. Audiologists use audiograms to test hearing. During this test, your provider plays sounds through headphones. You'll press a button when you hear a sound. The results measure your ability to hear. Vestibular test battery. Audiologists perform a series of tests to check the reflex of your inner ear, vestibular, balance system, and eye muscles. Brain magnetic resonance imaging, MRI, with contrast. This imaging test helps to rule out potential brain tumors or other issues that may cause dizziness or hearing loss. Peripheral vestibular disorder. Peripheral vestibular disorders are limited to cranial nerve 8 and all distal structures. Patients with a peripheral disorder demonstrate nystagmus to the contralateral side, which suppresses with visual fixation. Nystagmus improves with gaze towards the lesion and worsens with gaze opposite the lesion. Causes of peripheral vestibular disorders. Peripheral vestibular disorders often occur when the inner ear or vestibular nerve is damaged, due to causes such as chronic mastoiditis, otitis, labyrinthitis, trauma, fracture of the scapula, uterine junction, cerebral angiomas, Meniere's disease. Some other causes can also cause peripheral vestibular disorders, often living in a noisy environment, sudden weather changes, sedentary, stress, fatigue, prolonged pressure, or degenerative cervical spondylosis interferes with blood vessel circulation in the basal vertebral system. Diagnosis of peripheral vestibular disorder. Physical exam. H&N exam, C.N assessment, observe gait and posture. Oculomotor evaluation with or without Frenzel glasses. Tullio phenomenon, sound-induced vertigo, dizziness, nausea or nystagmus, dehiscence. Syndrome. Otologic exam, pneumatic otoscopy and audiometry. Henneberg sign, vertigo and abnormal eye movement with positive or negative pressure. Spontaneous nystagmus described. Type, degree, effect of visual fixation. Positional nystagmus and associated vertigo assessed with Dixall-Pike. Head thrust test. Move head to one side while patient maintains visual fixation if patients with unilateral vestibular weakness refixation saccade after the head thrust. Dynamic visual acuity test. Read Snellen chart with head stationary and then during 2 Hz head oscillation will detect bilateral vestibular loss with loss of 3 lines of acuity. Vestibular function tests. Electronystagmography, ENG. Battery of tests for vestibular function. Evaluate spontaneous and gaze-evoked nystagmus with and without fixation. Positional testing. Caloric response of the lateral SCC. Rotational chair testing. Eye movement studies. Smooth pursuit and optokinetic, saccade and vestibulo-ocular reflexes. VEMP. Benign paroxysmal positional vertigo, BPPV, is an inner ear disorder. A person with BPPV experiences a sudden spinning sensation whenever they move their head. BPPV isn't a sign of a serious problem, and it usually disappears on its own within a few days of the first episode. It could take several weeks for some people. However, the symptoms of BPPV can be very frightening and may be dangerous, especially in adults over the age of 65. The unsteadiness of BPPV can lead to falls, which are a leading cause of fractures. Causes of benign paroxysmal positional vertigo. Often, there's no known cause for BPPV. This is called idiopathic BPPV. When there is a known cause, BPPV is often associated with a minor to severe blow to your head. Less common causes of BPPV include disorders that damage your inner ear or, rarely, damage that occurs during ear surgery or long periods positioned on your back, such as in a dentist chair. BPPV also has been associated with migraines. Long-term effects of benign paroxysmal positional vertigo. Although BPPV is uncomfortable, it rarely causes complications. The dizziness of BPPV can make you unsteady, which may put you at greater risk of falling. Diagnosis of benign paroxysmal positional vertigo. Diagnosing BPPV involves taking a detailed history of a person's health. The doctor confirms the diagnosis by observing nystagmus, jerking of the person's eyes that accompanies the vertigo caused by changing head position. This is accomplished through a diagnostic test called the Dix-Hallpike maneuver. First, while sitting up, the person's head is turned about 45 degrees to one side. Next, the patient is quickly laid down backward with the head just over the edge of the examining table. This move can often bring on the vertigo, and the doctor can observe to see if the person's eyes show the jerking pattern of nystagmus. A positive response confirms the diagnosis of BPPV. An MRI or CT scan of the brain is usually unnecessary. A doctor's diagnosis of BPPV can be reassuring, especially when the patient understands that help is available to relieve the symptoms. Even without treatment, the usual course of the illness is lessening of symptoms over a period of days to weeks, and sometimes there is spontaneous resolution of the condition. Tinnitus. Tinnitus is the medical term for hearing noises in your ears. It occurs when there is no outside source of the sounds. Tinnitus is often called ringing in the ears. It may also sound like blowing, roaring, buzzing, hissing, humming, whistling, or sizzling. The noises heard can be soft or loud. The person may even think they're hearing air escaping, water running, the inside of a seashell, or musical notes. Causes of tinnitus. It is not known exactly what causes a person to hear sounds with no outside source of the noise. However, tinnitus can be a symptom of almost any ear problem, including ear infections, foreign objects or wax in the ear, hearing loss, Meniere's disease, an inner ear disorder that involves hearing loss and dizziness, problem with the eustachian tube that runs between the middle ear and the throat. Long-term effects of tinnitus. Tinnitus affects people differently. For some people, tinnitus can significantly affect quality of life. If you have tinnitus, you may also experience fatigue, stress, sleep problems, trouble concentrating, memory problems, depression, anxiety and irritability, headaches, problems with work and family life. Treating these linked conditions may not affect tinnitus directly, but it can help you feel better. Diagnosis of tinnitus. Tinnitus isn't a condition or disease. It's a symptom of other conditions. Here are some steps your provider may take to diagnose your tinnitus. Physical examination. They'll check your ears for any obvious problems. They may check for signs of pulsatile tinnitus. Medical history. They may ask if other family members have hearing loss, if you spend a lot of time around loud noises or a loud noise from a single event. They may ask what medications you take. Hearing test, audiometry. This test checks your ability to hear a range of tones, displaying your results in an audiogram. Tympanometry, your provider checks your eardrum with a handheld device called a tympanometer that shows your results in a tympanogram. Magnetic resonance imaging, this test produces detailed images of your body without using X-rays. Hearing loss happens when something affects your hearing system. If you have hearing loss, you may have trouble understanding, following, or participating in conversations. It may be hard for you to hear telephone conversations, to take part in online meetings, or follow dialogue when you're watching television. Causes of hearing loss. Many things can cause hearing loss. For example, short-term or sudden exposure to very loud noise, like attending a loud concert, can affect your hearing. Conductive hearing loss causes include earwax that's built up in your ear, fluid in your middle ear from colds or allergies, middle ear infection, otitis media, swimmer's ear, otitis externa, eustachian tube issues that traps fluid in your middle ear, ruptured eardrum, ear tumors, Something stuck in your ear. For example, your child, faced with a side dish of peas, may decide to put one in their ear. Congenital conditions, conditions present at birth, that affect how babies' middle or outer ears are formed. Sensory neural hearing loss causes include aging, illnesses like coronary artery disease, heart disease, high blood pressure, hypertension, strokes, or diabetes. Ototoxicity, certain genetic, inherited conditions. Being hit in the head. Noise-induced hearing loss. Long-term exposure to loud noise, like working in a very noisy environment like factories and construction sites. Congenital infections like cytomegalovirus, CMV. Mixed hearing loss in a combination of conductive and sensory neural hearing loss. That means it affects your outer and middle ear as well as your inner ear. For example, if you take medications that affect your inner ear and you accidentally rupture your eardrum in your middle ear, you have mixed hearing loss. Long-term effects of hearing loss. Hearing loss can make life less pleasant. Older adults with hearing loss often report being depressed. Because hearing loss can make it harder to talk with others, some people with hearing loss feel cut off from others. Hearing loss is also linked to loss of thinking skills, known as cognitive impairment. Hearing loss also is linked to risk of falling. Diagnosis of hearing loss. Tests to diagnose hearing loss may include physical exam. A healthcare provider looks in your ear for possible causes of your hearing loss, such as earwax or an infection. The way your ear is formed might cause hearing problems as well. Screening tests. A whisper test, which involves covering one ear at a time while listening to words spoken at many volumes, can show how you react to other sounds. App-based hearing tests. You can use a mobile app on your tablet to screen yourself for hearing loss. Tuning fork tests. Tuning forks are two-pronged, metal instruments that make sounds when hit. Simple tests with tuning forks can help find hearing loss. They may also show where the ear damage is. Audiometer tests. A specialist in hearing loss, known as an audiologist, does these more thorough tests. Sounds and words are directed through earphones to each ear. Each tone is repeated at low levels to find the quietest sound you can hear. If you were discharged veteran from U.S. military and looking for the compensation you can get for the ear conditions, please check out our other video on ear conditions with compensation rating. Thank you for watching our video. Please don't forget to subscribe and like our videos.